Hi, my name is Melinda Corey. I'm doing this presentation for SEI 501, and my presentation today is on infant mental health, what it is, and how we can support it. There's a PowerPoint presentation you can follow along with if you so choose. I'm not going to read the PowerPoint word for word, but I will be hitting the high points as part of my discussion today. So when you hear the word infant mental health, or the phrase infant mental health, what comes to your mind? What do you think of? I'll give you a minute to think about it. I know when I first started thinking about infant mental health, when my son was born almost 4 years ago, I didn't really understand a lot about what it was, but I knew that it was interesting and that I wanted to learn more about it. I never really thought of infant mental health as being a real thing, I guess. I thought about mental illness as being something that impacted adults or older children, but I never really thought about infant mental health. And I wonder, when I say infant mental health, if that came to anybody else's mind, was that, maybe that you haven't necessarily heard that term, or that you thought that mental health was sort of something related to older children. But infant mental health, as you can see from slide 2 on your presentation, is that the social emotional well-being of very young children in the context of family relationships. So social emotional development tends to be something that we're a little more familiar with. It's a more familiar term in the early childhood world. And infant mental health is sort of a facet of that looks at very young children and how they are developing in the context of family relationships. And we now know that disorders of infant mental health are evident very early in some cases, as early as 2 to 3 months, depending on the situation. These can include things like depression, attachment problems, regulation disorders, among other things. So what I'd like to talk about for a few minutes is what sort of factors impact mental health. What do we need to be looking for when we're talking about infant mental health and social emotional development? So some of the factors include temperament, which is sort of the inborn personality that we all come with. This can be, a more difficult, slow to warm up temperament. It can be a pretty easygoing temperament. It varies a lot from child to child, and some children can be a combination of one or more temperaments, but traditionally children are typically categorized into one of 3 very broad categories. And there's a goodness of fit to discuss when it comes to temperament. If the parent's temperament is very laid back and flexible, and the child's temperament when they're born is more, feisty or needy, it can be very difficult for that caregiver to adjust to dealing with an infant who presents a very different picture of themselves. There are also some very individual things that impact infant mental health. Just every individual matures a little differently, comes with some different coping skills, and also is taught some different coping skills indirectly and directly from their environment as a very young child. And then there are some big risk factors that I'd like to dive into a little more deeply, including poverty. Poverty in and of itself does not cause mental illness, and we know this, but it raises the risk of mental illness because of other things: lack of access to healthcare and support services, frequent disruptions that happen in families living in poverty, like needing to move frequently because of being evicted for not paying rent, or for needing to live with various family members who will take them in because they can't afford housing. Things like this can impact very young children who are somewhat dependent on rhythm and routine, and who, although they may not understand exactly what's going on, can certainly pick up on the stress that adults are feeling, and a stressful environment can be difficult for a very young child without a lot of coping skills to navigate. Another major risk factor is simply the relationships that an infant has. Everything that children do happens in the context of relationships with parents, with other relatives, with caregivers, with siblings. If a parent or caregiver is suffering from a mental illness or another serious problem and they're unable to access treatment or unwilling to access treatment, this can have a significant impact on the development of the infant's mental health, because the infant is so dependent on the adult for co-regulation at that early age. There was an interesting study that came out a few years ago. We'll be referring to it a few times throughout the presentation, the Adverse Childhood Experiences Study, which found strong relationships between several categories of adverse events and the presence in adulthood of a variety of negative outcomes. Adverse events in childhood simply refers to negative childhood experiences, such as various types of abuse, violence or drug use in the home, things like this. And so these events experienced in early childhood, it was found, led to much higher risks of adult risky behaviors like promiscuity, criminal behaviors and imprisonment, as well as adult health risks, which was an interesting finding that having these adverse events in your life as a young child led to higher rates of obesity, unwanted pregnancy, heart disease, cancer, and all manner of negative health outcomes. So now that we know what some of the factors are that can impact infant mental health, let's talk about how we can assess infant mental health. I'm wondering if people have experience with assessing very young children who may have these risk factors and what those sorts of assessments have looked like, or how you can imagine yourself assessing a child if you thought perhaps there was an early onset mental illness or risk for mental illness happening. One example or vignette I'd like to share to maybe spur your thinking a little bit on that is the example of a child whose name has been changed, who I've worked with, whose name is Timothy, who is in foster care and was removed from a home where there was domestic violence, substance abuse, and significant neglect. And now he is turning 3, and he has a significant speech delay, and he has been diagnosed with an anxiety disorder. He struggles with transitions and with testing kinds of behaviors. And if Timothy were coming to your preschool classroom this fall, how would you assess him? What kinds of things would you like to observe or do to find out more about what Timothy's mental health or social emotional development might look like? So there are a number of ways to assess infant mental health. Some have been more researched than others. It is very difficult to assess at times for a number of factors, including the fact that often children who are young will display behaviors or social emotional difficulties in some situations and not others. For example, Timothy from the vignette I just shared does very well with his foster family and would not appear to have anxiety or significant behaviors when he's with them. However, when he's on supervised visits with his biological family, he exhibits headbanging, biting, and a number of other aggressive and self-injurious behaviors. So an assessment like the BDI that we do for early intervention eligibility may or may not capture that sort of thing. It's been determined over time, looking at standardized measures like the BDI, looking at rating scales, sociometric measures, a variety of things, that the most successful way to assess young children for mental illness and social emotional skills may be a combination of observation and parent and caregiver interviews. And it's important for the observation to be done across settings so that there's not just a 1 or 2 hour snapshot of a child in one setting, but that there's a cross section of days, weeks, even perhaps depending on the situation, and that there's a significant portion of the assessment being these parent interviews, because you want to hear what's happening when you're not there. You can't observe every behavior of concern in an assessment period, and it's important to consider what is going on for the family, especially in early intervention work, because that's really where the focus is working with the whole family. And because infant mental health takes place in the context of relationships, it's very important to get to know the family, get to know their culture, and consider what may be going on there that is contributing to that child's well-being or to their concerning behaviors. So, for example, when considering the family's culture or language or religion, you may want to consider the family's history with social service agencies, the family's experience with mental illness and the possible stigma that comes along with that. The family's access to health care and treatment. Are they embarrassed or ashamed to go to therapy? Are they embarrassed to let anyone know that their child is having these problems? It's important to really get to know and respect what a family is going through to get the best picture of the child. So once a child is assessed, a diagnosis may be advanced, depending on the evaluator, from the DC 0 to 3R, which was developed in 1994. It is a sort of companion to the DSM-4 that talks about classifying mental health disorders in children birth to 3. And often these diagnoses have a companion diagnosis in the DSM-4 that a child might get if they were a little bit older, but this diagnosis from the DC 03R may be a little more appropriate for a very young child. So all that said, what we really want to know is how can we help these kids? So what I'd like to talk about is what has helped children that you've worked with in the past. What could help a child like Timothy, who's really struggling with some concerning mental health and behavioral needs.